Wow, great to see so many people. Thank you for coming. First off, I just want to say it's great to have the opportunity to come talk at events like this. So thank you so much for everyone who made it out, and thank you so much for everyone who made this event possible. Is it working? Oh, 1 second, I'll be right back. Okay, that's for the next slide. Yeah. Don't worry, it's not finished. Okay, so quick introduction. My name is Liaw. I'm a medical doctor. I recently graduated from the Royal College of Surgeons in Ireland, and now I spend most of my time trying to teach people healthy lifestyle in order to optimize their health, and I do so on different social media platforms such as YouTube, Instagram, and I have my own website where I work one-on-one with people as well. As much as I love talking though, you know, it can be a little bit boring to listen to one person just babbling on for 45 minutes. So I'm going to try to make this a little bit interactive. Now, I know maybe for the guys in the... Oh, okay. Thank you. Getting some feedback straight away. So I'll try to talk a little bit slower. Yes. Oh, okay. Oh, I see, I see. Okay, I'll try my best to slow down so the translators can keep up. Ah, okay. I didn't realize that. Thank you. Okay, so I'll keep myself on this side of the screen. Okay, very good. So what I'm going to do is I'm going to ask you guys a question, and feel free to shout out some ideas. And the question I'm going to ask you, if you were going to see a doctor, what are some things that you would like in that doctor, whether it be the first time you see him or someone you're going to see regularly? What are some things? Shout out some things you'd like in your doctor. Sorry? Handsome. Well, this doctor is sure enough handsome. Knowledgeable. Okay, very good. Healthy. Okay, lots of good suggestions. Caring and single. Okay, all the important ones coming out. Very good. Empathy. Okay, very important. Empathy. Knowledge, nutrition. Okay, perfect. That's a very good one. Oh, vegan. Oh, those are, now you guys are getting a little bit too demanding here. Okay. Okay, yeah, very good, very good. Okay, so let me just tell you a little story. So this is from a few years back now, back when I was studying in medical school, and it was my first ever clinical rotation in a hospital called Beaumont Hospital in Dublin. And I was walking in, I had a rotation in gastroenterology, which just means digestive or gut health. And so as a medical student, you walk into the clinic and you're always trying to find the intern who is, you know, the doctors who've been working for the least amount of time. So these are usually the least intimidating people to talk to. And then you have the SHOs, you have the registrars, and you have the consultants at the top, who are the big bosses, the scary ones who no one wants to talk to. So I walked into the clinic, and the first person I started talking to was an SHO. And so I got to talking to him, and he was like, oh, actually, just follow me, and we'll do some jobs. I'll teach you a little bit about gastroenterology. So we walk around from patient to patient, to job. You know, he's really good, really on top of his stuff. He's very knowledgeable. He's empathetic. The patients love him. His colleagues love him. And so he gets me to do, you know, we saw a peritoneal tap, which is where you're draining fluid from the area around your internal organs. And things like in patients with liver failure, what happens is one of the main functions of the liver is to synthesize proteins. And so when you have liver failure, you stop synthesizing all the proteins that you're supposed to be making, so the blood becomes very thin and it loses its ability to hold on to the fluid, so you get fluid leaking out into these spaces. So we had to put in a needle and then drain all that fluid. Everything went well, patient happy, colleagues happy, fantastic. And then next we go to another patient, and he asked me, Leo, have you ever done an NG tube, which is a nasogastric tube? So you put it up through the nose to the back of the throat and down to the stomach. So this is for patients who can't, you know, swallow. And so you can get food directly into the stomach. And so I was like, no. He's like, well, first time now, let's do it. And then, you know, he goes through first with a mannequin, a doll, and shows me how to do it. And then I do on the patient. Success, very good. So not only was he really good with everyone around him, but he was a really good teacher. And I just found myself looking up to him and saying, wow, you know, if I were to practice medicine in a hospital, I would really want to be like this doctor. He just really seems to know his stuff. And so, you know, we're walking and he gets a little bleep on one of these, you know, almost like a telephone call that they have on the belt. And they tell him, okay, so there's a farm rep lunch, come up. And he says, Leo, are you hungry? Come up with us. Oh, okay, free food, sure. You know, as a student, I'm not going to say no to free food. So we go up, and by the way, on a side note, this is one of the things I still find a little bit strange in medicine, even though it's in most countries illegal to get direct gifts or payments from pharmaceutical representatives. You still get these free lunches where the farm reps come and tell you what drugs to use, and it's a little bit strange. But anyways, we get up there, and being the gentleman he is, this doctor says, "Leo, do you want some cheese and ham sandwich?" I was like, "No, I'm okay, thank you." He says, "Oh, okay. Do you want some of this omelette?" And I'm like, "No, I don't eat that." He's like, "Oh, really? Why not?" And comes up, I'm vegan, So I said, "Oh, what? You're vegan? Oh, wow. Okay, interesting. So I just have one question for you." And I go, "Oh, okay. All right, let's hear it. Ask away." This is. There you go. Where do you get your protein? And, everything, I was looking up to you. How can you do this? No. And the reason I tell you this story is because, like I said, this guy was obviously a very intelligent guy. He knew his stuff, very good at his job. But this same person had no idea about nutrition. He thought, as a vegan, you'd have trouble getting protein. And this is not an exception. This is the norm. I can't tell you how many times I've talked to whether it be the SHOs, registrars, interns, or the big boss consultants, and they have almost no knowledge of nutrition whatsoever. I heard them all from how can you get calcium without milk? How can you get omega-3s without fish? Protein without meat, right? And it's not their fault, like I said, it's not because they're stupid or they're not interested in helping people. It's just they're not taught. It's not in the medical program. In medical school, we're not taught this, and through professional training, we are not taught this either. So it's a very big shame, but I tell you this just because if you have it in your head, that idea that medical doctors are a reliable source for nutrition information, forget it. Perfect. Throw that out in the trash because it's not true. Okay, so that's the first thing. And then I want to say, imagine that doctor asked any of these four, where do you get your protein? What do you think about that? Yeah, especially the one on the bottom right there. Have any of you guys seen Game Changers? Yes, amazing movie. Very good. I think that movie is going to do so much good for the world. But yeah, just in terms of the medical education then, just so you guys know, because I recently, I only graduated this year, so I'm basically, a lot of people think, oh, maybe doctors back in the day didn't get taught nutrition, but nowadays I'm sure, because, it's such an important thing. Nutrition is so important for health. It only makes sense that as the health experts in society, doctors should know a lot about nutrition, right? It only makes sense. But as someone who just graduated this year, I can tell you, we were taught the food pyramid right here. So the food pyramid from 1992. That's what we're being taught today in medical school. So yeah, I know it's depressing, but this is, obviously I can only speak for my school and my experience, but a lot of my colleagues who I've spoken to from other countries around the world have similar experiences where it's barely any nutrition, if any whatsoever. And so medical doctors on average know little more than your average person around nutrition. So it's important to keep in mind. Now, the other thing I always love to talk about is evidence, because we've never lived in a time as today where we have a greater access to information, right? Everywhere you look, you can find so much information about every single topic, but then it becomes difficult to sift through the information and see which kind of information is good information and which kind of information is bad information. And this is something that we talk a lot about in medicine, because as doctors, we can't just give advice to patients based on gut feeling, or I think I heard somebody say that this is good, or anything like that. So everything has to be evidence-based. And so this is a concept that I think everyone should be taught, should be implemented in all schools, because being factually based is so important when it comes to aligning yourself with the truth rather than opinion. So I'm going to show you guys the hierarchy of evidence. So this is basically what the entire medical field uses to base their advice on. So like I said, everything has to have some sort of study, some sort of evidence in the scientific literature for you to be confident giving that advice to patients. And so I'm just going to go through this and talk a little bit about the different types. So the very bottom of the hierarchy of evidence, you have animal and laboratory studies. And the reason this is at the very bottom and it's not very reliable is because a lot of times biological processes that happen outside of the human body in a test tube or in a petri dish or in an animal from a different species than human beings is actually quite different from how things happen in our body. So it's oftentimes not very relevant to our biology, to our specific circumstances. So it's very dangerous to base your opinion solely on this type of information. And the other thing I like to just mention on a side note is that there's actually, to my knowledge, in most countries today, there is no such thing as vegan medicine. All medications are not vegan, and the reason for that is because for them to be approved, all medications in most countries have to go through animal testing before it can go on to human testing. And there's a few problems with that. So number one, a lot of things that end up being safe in animals other than humans, when they get tested in human beings, it actually ends up being very dangerous in human beings. So it can give a false sense of security. And then the opposite is also true. There are some medications that fail animal testing and therefore get cut out. We're never going to test this. And theoretically, this could be an amazing drug, an amazing medication that could, solve so many problems, but we will never know because it failed animal testing, and so it never goes on to the next step. So it's far from a perfect. It's an imperfect system, needs to change, and the reason I'm mentioning this, I don't want people to stop taking medications. Obviously, as vegans, I think people are trying to do the best to their abilities in terms of avoiding harm to other animals. However, I think it's completely unreasonable for you to sacrifice yourself or something like that because you don't want to take a medication because it's vegan. I think we should rather focus on changing the system. If it's a life-saving medication, definitely take it, whether it's vegan or not. That's my recommendation. Now, the next section here, case reports, case series, narrative reviews, expert editorials. The one I really want to focus on here is expert opinions. So this is, again, at the very, very bottom of the hierarchy of evidence. And this counts for doctors, nutritionists, any type of expert is one, whenever I'm talking about this kind of stuff, I always say, don't, trust what I think. It doesn't matter what I think. It's not interesting. I don't care about what other people think when it comes to the facts, when it comes to the science, right? Because human beings, there's nothing that is more human than making mistakes. It's part of human nature, right? So if you're basing your factual opinions on other people's opinions, this is extremely, extremely unreliable. And, so whenever you're trying to get to the truth, the bottom of something, don't base that on a personal opinion. Always look at the facts. The facts only come from the top sections of the hierarchy of evidence. So going up, we have case control studies, which are places where you compare disease rates in different populations and see if there are different rates depending on exposure risks. You have cohort studies. So prospective cohort studies are where you take, again, two groups of people. You try to control for as many of the things as possible, and then you see, okay, smokers versus non-smokers for 30 years, for example, if there's different rates of lung cancer, right? So this is the type of studies that were done a lot to actually find out that smoking caused lung cancer. And then even higher up, we have randomized controlled trials. So you have something called double-blinded, placebo-controlled randomized trials. So this is basically the gold standard for testing medications, and this is where the doctors don't know who's getting what, the patients don't know who's getting what. They're in a controlled center, so you know exactly what's going in and out. And then some people get the placebo, so a sugar pill, and then some people get the medication. And then you actually get the real effects of those medications. And this is actually the reason they do it is because the placebo is actually proven quite a powerful effect, actually. So this is the gold standard for most medications, like I said. But again, if you're going to control people and every single thing that they're doing, it's hard to do these for nutrition. There are actually some randomized control trials for things like heart disease and diabetes, but it's quite difficult to do for, you can't get people into a center and follow them for 20 years on a randomized control trial. That would be way too expensive and nobody would sign up, right? And then at the very top, or almost at the very top, you have meta-analyses and systematic reviews. So this is basically where they take a large number of studies that are looking at similar outcomes, similar endpoints that they're investigating, and they're putting all of that data together to increase the power of the study, so to increase the reliability of the conclusion. So whenever you're dealing with research, the bigger your sample size, the more likely that the conclusions you come to are going to be correct, right? So this is why they do these meta-analyses and systematic reviews, where they're trying to get as much high-quality information and so that their conclusions are correct. And at the very, very top, you have clinical practice guidelines. So the reason this is at the very top is because you have professionals who are good at reviewing studies, who are good at reviewing statistics and research, and they're putting exactly what we're talking about, all the evidence in certain fields together to come to the best evidence-based recommendations. So a great example of this is when the World Health Organization and the International Agency for Research on Cancer came out with a report that red meat is a class 2A carcinogen and processed meats are a class 1 carcinogen. That was done by 22 of the leading experts in the world, taking over 820 studies and putting all of that data together to come to that conclusion, right? So huge, huge amount of work, and you can imagine it's difficult for someone who, you know, has a family or has a different job or who doesn't have the required knowledge it's just unrealistic to expect everyone to do that by themselves, and that's why the clinical practice guidelines can be so important. Now, I'm sure you guys have, or many of you have probably experienced this, where you have something like the World Health Organization's reports, right, which is based on a huge amount of work and a huge amount of evidence, over 800 studies, and then you have someone say, oh, well, I found this study that shows meat is good for you, right? How many times have you guys heard that, right? So you can't, you can't compare. That's the problem as well with the media. The media oftentimes compares these two as if they were equals, whereas one is a very, very high quality evidence, the other one is just one study. And one study is always just a small piece to a large puzzle. You can't just base your opinion on one study. So if you ever hear someone say, well, I found a study that proves this, that's already incorrect, because one study by itself never proves anything. It's just one small piece. Okay, so here, I like this quote. I actually had to look up the guy who did the quote, because one time I did a talk and I had a quote on and I said, oh, so I found this quote by this guy called Siddhartha Gautama. Yeah, it's an amazing quote. And then I said the quote, and then at the end of the talk, someone came up to me and was like, yeah, Leo, I liked your talk. I was like, oh, thank you, thank you. He says, by the way, you know that the quote you took, you know that guy, right? It's Buddha. And I was like, oh, okay, that was embarrassing. So now I checked out who the guy is. He's apparently one of the most famous American self-help authors and motivational speakers. He used to do counseling, psychology as a professor. And I just really like this quote. The highest form of ignorance is when you reject something you don't know anything about, right? So how often do you see people criticizing others when they have no idea what they're criticizing, right? Or saying that they know something, whether it be nutrition, lifestyle, sports, any cultural beliefs, anything like that, and they say, this is how it is, and yet they have no fund of knowledge to back that opinion. There's another quote, actually, I don't have it here, which is, the greatest enemy to mankind is not ignorance, it's illusion of knowledge. That's another great one, right? It's people thinking they know something, when in reality, if they just accepted that they were ignorant, that would actually be much better. Because if you accept, what, I don't know this, you're open to learning about it. Whereas if you're trying to say, oh, I know everything, right? You kind of lock yourself in that position, like, I know this is to be true, then you're kind of stopping yourself from progressing any further. And I believe a lot of times the same with the evidence, right? I say don't listen to personal opinion, listen to expert opinion, listen to the evidence, because that's the most realistic. So I think we should always try to align ourselves with the most realistic concepts. And when it comes to ignorance, I think there is probably nothing more unrealistic than thinking that you know a lot. Just think about all of the knowledge that exists in the world, whether it be, physics, biology, chemistry, mathematics, history, linguistics, geography, culture, religion, everything, all the knowledge that exists in the world. How much do you think one single human being could know from all of that? Like, let's see some numbers. How much do you guys think you can? 3%, okay. Anyone? 1%, okay. I actually asked this to one of my to one of my classmates in medical school, and he said, "Yeah, no, I think I know about 70%." And you know, he was American, that's why I'm doing the accent. Wow, you think you know 70% of all knowledge? Wow, that's amazing. I think I probably know less than 0.1%. You know, and he said, "Nah, Leo, come on, man. You know at least like 50%, man." And I was like, "Okay, number one, why do you think we know so much? And number two, why do you think you know 20% more than me? You know, what? Makes no sense." So yeah, I think again, it's extremely unrealistic to think that we can know that much, and therefore, I think this is kind of the humility of science. It's one of the stepping stones of science, is that what we think we know may be proven to be incorrect as more knowledge comes in, as more information comes in. And I think if everybody just kept that in mind a little bit more often, it would definitely open up the way to stay more aligned with the truth and not get ourselves emotionally stuck on being right all the time, because you know it's nonsense. It's completely unrealistic to think that human beings are going to know such a huge amount of information, right? But so, you know, I don't want everyone to just put your hands up and be like, oh, okay, we don't know anything, you know, nothing. We do actually know a few things. From an evidence-based point of view, what do we actually know when it comes to plant-based diets? So there are a few areas where the evidence is so overwhelming, it's so strong. We have so many prospective cohort studies, so many randomized controls trials, meta-analyses, and even position papers, even guidelines and advice where the biggest organizations of professionals are putting it out there that vegan diets do better than any other diet studied in these four areas. And the four areas are: number one, heart disease. So heart disease or cardiovascular disease is the number one killer in the world, killing over 18 million people every single year. And in this area, the plant-based diet, the whole foods plant-based diet, is the only diet shown to not just prevent, but even reverse, in most cases, disease. So amazing. Number one killer, plant-based diets. That should already be enough. That's where the discussion should end. No, but we have more. So number two, type 2 diabetes. Again, super common, epidemic. 1.5 million people die per year, leading cause of blindness, renal failure, amputations, horrible disease. And most people think this is a chronic disease that you can do nothing about, right? It's just going to get worse and worse and worse until you die. However, that does not have to be the case. Again, plant-based diet has been shown to help treating these patients, but also very, very powerful in preventing this from even happening in the first place. Number three, hypertension or high blood pressure. So this is, again, so normal that we almost expect in medicine, we almost expect anyone who comes in, you know, over 60 years old, we almost expect them to be at least on one blood pressure medication. Otherwise, it's so strange, you know. But again, it's become normal, but normal does not always mean good, right? And just because something is normal does not mean that that's how it's supposed to be. And when it comes to high blood pressure, again, huge amount of evidence. It's better than any other diet studied today in terms of preventing and treating high blood pressure. Oh, sorry, I forgot the fourth one. The fourth one is different types of cancer. So you have prostate, breast, and colorectal cancer, which are 3 of the 4 top killing cancers. And again, plant-based diets do the best in terms of preventing these 4. So anyways, been talking a little bit about diet, just to mention a few other things to keep in mind then. So obviously we want to be focusing on whole foods instead of processed foods. A lot of the events we come to, like I just sat down and had a burger, so I'll put my hand up and say, okay, look, exceptions are okay every now and then, but it's the day-to-day that counts. It's what you're doing for a long time, for the rest of your life, on a daily basis. That is really what's important. If, you know, every time there's a Christmas party or an event, you have something that's not optimal, you know, that's okay. But whole foods, plant-based, the staples are fruits, vegetables, whole grains, legumes. Add some nuts and seeds, depending on, the only problem with nuts and seeds is that they're extremely healthy, but they contain a lot of calories. So if you're trying to lose weight, try to minimize it to 1 handful a day. And then herbs, spices, make water your drink of choice. Those are basically, you know, there's so much confusion around nutrition, but it doesn't have to be that complicated. You can actually make nutrition quite simple. It doesn't have to be this, you know, laboratory, like calculating everything. It doesn't have to be that difficult. The principles of a healthy diet are actually pretty simple, and the benefits, like we talked about, are huge. Now for the rest of the talk, sorry, am I speaking too quickly again? A little bit? Okay, so for the rest of the talk, I am going to speak about some of the other lifestyle factors. Because, you know, a lot of times we say, oh, it's all about exercise, right? It's only exercise that makes us healthy, or it's all about diet, or it's all about genes. I think humans are a little bit dualistic. We like to think of everything black or white, right or wrong. But we have evidence for quite a few lifestyle factors that do optimally or optimize our health, do improve our long-term health. And so diet is definitely one of the most important ones, but it's definitely not the only one. And there are a few other things that we can all do to improve our health. One of them, as I mentioned, exercise. So you don't have to go to the gym 2 hours a day or anything like that, right? It's, you know, again, a lot of extreme trends in society where either you just couch potato, sit and watch Netflix all day and eat potato chips, or, you know, run marathons and Ironmans and all, but it doesn't have to be that extreme. The World Health Organization actually recommends 150 minutes a week of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. So it's not that difficult to reach those numbers. You probably get some more benefits if you even go to twice that, so either 300 of moderate intensity or 150 of vigorous intensity per week. But like I said, to get those minutes in a few times a week, it's great. And I would say the most important thing is to find some sort of exercise, some sort of sport that you enjoy doing, because if you're going to do it for the rest of your life, then you don't want it to be something that's, oh, what a hassle to go and do it again, right? So find something that you enjoy doing, and that way it will be a pleasure to do it for the rest of your life rather than a drag. So that is exercise. Next up, sleep. This is one that I am suffering a little bit from because I landed at 5:30 a.m. This morning. So my sleep is a little bit off, but extremely important again. It's been shown to really help prevent a lot of these chronic lifestyle-related diseases. And when it comes to sleep, there is one thing I would recommend everybody look into. You know, either write it down in your phones or just remember it in your heads, but it's something called sleep hygiene. Because apart from anatomical and, you know, kind of rarer things where people have actual physical issues that keep them from breathing or keep them from sleeping properly, for most people, the number one thing we can do to improve sleep is to look at sleep hygiene. And what sleep hygiene is these evidence-based guidelines to behaviors that help support good sleep, and then some behaviors that support bad sleep that we should avoid. So sleep hygiene, look it up, see what kind of things you're doing, see the things that you aren't doing, and just see if there's anything that would be convenient for you to incorporate into your life to improve your quality of sleep. Okay, number 4, well, not really meditation, relaxation. Relaxation. Stress, again, is a factor. We have a huge amount of evidence suggesting that it's not great for us. It does increase our risk of heart disease, high blood pressure, etc. And the meditation is one of the ones that we have actually the best amount of data, but it doesn't have to be meditation. Any relaxation routine, anything that keeps you, you know, a little bit more relaxed on the down low. Some people like to take hot baths. Some people like to take walks out in nature. Some people like what's it called, the nets that you like. There's so many things that you can do, right? Exercise will help with relaxation. And then meditation, of course, you don't need to do it with this beautiful backdrop or the ocean and, you know, the sunset and perfect, like Instagram worthy. No, you don't have to do that. So meditation, you can do it anywhere. But again, incorporating some relaxation routines is probably a good thing for the majority of us. And the 5th one that I like to talk a little bit about is, I call it reconnection. It's kind of putting together social, mental well-being. And I think this is something that's not talked enough about in society today, because there's still a little bit of this stigma, a little bit of a taboo around mental health. You know, some people feel like it's shameful. You know, if you have a good life, you have a good economy, you have food on the table, you know, we shouldn't be complaining. But in fact, mental health issues are one of the biggest things in society today. It's probably very underdiagnosed, and yet studies are finding that, you know, rates of up to 10% of people at some stage in their life suffer from depression. There's so many other things, social anxiety, personality disorders, so many things, and yet we're not really talking about it. We're not looking into it as much as we should. So learning a little bit about this can be helpful for most people. Again, it's not an all or nothing thing, right? A lot of people think, oh, I'm not mentally ill, I shouldn't have to look at any of this information. But again, it's not, every one of us has some psychological patterns that are more helpful and some that are maybe a bit less helpful. And just being aware of some of these things can help all of us probably move a little bit towards the more helpful side. So a few things that I would like to say in terms of mental health. First things first, the number one predictor of happiness, the number one predictor of good mental health, trumps diet, trumps exercise, trumps everything else. The number one predictor is quality human relationships. Spending real time with real people. And in the age of social media where we're all on our phones, we're all on Facebook, we're all on YouTube, this is sometimes kind of ignored. It's kind of paradoxical. It's called social media because, it's actually keeping people from being social in reality. It should be called unsocial media. But yeah, so quality human relationships, extremely important. Yes. So they've done a lot of studies on this, and it's the number one predictor. Beats all the other things. Yeah. Now, it's not the only thing. Again, we don't want to oversimplify things and say that this is the only thing that matters when it comes to mental health. There are other things too. The other thing I learned actually about human psychology, which was very interesting, is that human beings, for the most part, are actually subconscious animals. Most of the things that go through our head are happening at a subconscious level. Our reactions, the things we say, the way we walk, the way we talk, the things we think about others and our environment, a lot of this is actually completely subconscious, and being aware of that can actually help you kind of see where some of these patterns are coming up. And the nice thing, we have something called cognitive behavioral therapy in psychiatry and medicine, which is one of the most evidence-based therapies for things like depression, social anxiety, etc. And basically, we work on this connection from people's emotional thoughts, physical symptoms, behaviors, and we're trying to replace some of these subconscious beliefs people have with more helpful ones that are more aligned with reality. So just as an example, if somebody walks past you and doesn't say hi and you know them, some people might assume, oh, he just ignored me, he doesn't want to talk to me, blah, blah, blah. And you have this negative thing. Never even thought that you should think this way, right? It's just subconscious programming that happened, and that's why you're reacting this way. However, then if we can actually go in, and this is the beauty of it, it's a two-way street, right? Even though your subconscious mind can affect how you consciously think, the opposite is true. So how you consciously think and the decisions that you're making, if you repeat them enough and you live it enough, it can actually go the opposite direction and affect your subconscious mind and then change some of those conscious programs. So that is what they do in cognitive behavioral therapy. They try to replace some of these unrealistic, unhelpful patterns with more helpful ones. And there are four main, what they call them cognitive distortions, four main ones that they usually talk about. So I might as well just tell you guys real quick what they are. Because like I said, it's not all or nothing. A lot of us do have some of these unhelpful patterns, and to recognize them and be like, oh, I'm doing this, maybe I should, it can actually help just being aware and catching them. So number one is something called selective abstraction. So selective abstraction is what happens when people always focus on the worst part of something, right? So imagine you're on a trip with some friends and there's lots of good stuff, but then something goes wrong, and then this one person is going to be putting in overly focus on that bad thing, right? Exactly. So that's selective abstraction. The other one is arbitrary inference. So this is kind of similar, but instead of focusing on the worst part, it's actually making the worst possible conclusion out of every situation. So the example I talked about before, somebody walks past you, you say, oh, this person ignored me, he or she doesn't like me, right? That's arbitrary inference. Instead of thinking, oh, maybe he or she didn't see me, maybe he, is busy, maybe he's, on the phone or whatever, so you make more positive, more realistic, perhaps, assumptions. Third one then, we have overgeneralization. So this is where you make or you generalize conclusions about your own personal worth from one example. So I don't know, example, let's say you're playing football and you miss a penalty, and then you say, oh, instead of saying, oh, I'm bad at penalties, you say, oh, I'm so bad at sports, I'm uncoordinated, I'm this and that. So this is overgeneralization, right? And again, can be applied to so many areas of life. And then the last one that perhaps you might, recognize is, because this one's actually very common, is minimization and maximization. So this is where your performance, you often underestimate your performance, and then whenever you make an error or a mistake, you magnify it, you over-exaggerate it, right? So you have this unrealistic, sorry? Yeah, exactly. So you have this unrealistic way of thinking that your errors are huge, but then your performance is, no, that's no big deal, it's just a small thing, right? So again, recognizing some of these patterns could be, already a big stepping stone and trying to shift towards a more positive mindset. But anyways, this is like in my opinion, a very, very interesting human psychology, behavioral psychology, extremely interesting stuff. And hopefully, as the taboo washes away and people start talking about it, we're going to do more and more research and learn more and more about this stuff, because it is super, super key, super important for health as well. Last thing, I don't know how we're doing for time. I think we have a few more minutes. So I'm going to talk a little bit about the pillars of medical ethics, because this is, again, as doctors, we try to be ethical. We try to live up to the standard, and we're actually viewed as one of the professions that still are viewed pretty positively by most of society in terms of being reliable and wanting to help and wanting to do the best for their patients. And so the 4 pillars of medical ethics, you have first autonomy, which means allowing people to reign over themselves, reign over their own bodies, make their own decisions. So you're not going to force someone through a treatment if they don't want to do it, right? People have the right to decide what they do with their own bodies. So that's autonomy. Then you have beneficence, which is trying to help, trying to do good, trying to do your best to solve whatever problems your patients are coming in with, right? Then you have non-maleficence. This is the do no harm. I'm sure many of you have heard of. So obviously, if you have a treatment that is not really going to help someone but has the potential to really harm them, then you don't want to do it because of non-maleficence. So you don't want to harm people when you don't have to, right? And then the last one is justice, pretty self-explanatory. You want to be fair to your patients, and this one comes a lot in terms of allocating resources, that you don't want to treat, one patient over another, etc. And these are the 4 pillars that we're always wrestling with in the medical industry, and we're trying to use in order to make sure our decisions are ethically correct. And the reason I also like to talk about this is because, in medicine we talk a lot about this ethics, but we are only talking about it towards patients. But if you just expand this a little bit towards outside of medicine, and you think about people in general, society in general, maybe even animals in general, maybe the planet in general, then you can start seeing that if you're applying a lot of these, a lot of these concepts, a lot of these ethical pillars that we use in medicine to other areas of life, then you will start seeing a lot of overlap with some of the concepts behind veganism, which I'm sure many of you are familiar with as well. So I think this is something that is very beautiful about humanity, is that we have the potential to do so much good as well, and we have the potential to kind of raise above this kind of jungle of survival of the fittest, etc. And I've tried not to talk too much about ethics in the past, because a lot of times people view, if you're talking about ethics, you're emotional and you're not being factual, you're not going to be logical. And obviously this can be true. Otherwise, the only logical people in society would be psychopaths, right? Because if you can't have any emotion to be logical, then psychopaths would be the only logical people on the planet. So obviously they're not mutually exclusive. You can have emotions and still be logical in your thinking. And I don't think anyone, whether you be a scientist or not, having compassion for the weak, helping the innocent, remorse for the helpless, these are, like I said, one of the most beautiful values that we have as humanity, and being ashamed of that, whether you're a scientist or not, is nonsense. So I don't think anybody should ever be ashamed of those things. And yes, I guess that is it. That is, I actually wasn't sure if that was the last slide or not. So that is the end of my talk. I hope you guys found some of this information interesting. I definitely think, like I said, this is one of the most important things. Of course, if you're wanting to optimize your health and you want to be around and be healthy and feel good for as long as possible, then we want to incorporate as many of these things as possible. Obviously, you can't be 100% on all of the factors, but incorporating as many of these things as possible is going to give you the best effect instead of just focusing on only diet or only training or whatever. If anyone has any extra questions, I'll probably be outside the lecture room around. Oh, yes. So I studied in Ireland, but I'm not Irish. I'm half Norwegian, half Brazilian. Very strange mix. Yeah. So, yeah, it's opposites, like the polar north and the tropics. But, yeah, so like I said, I'm going to be probably outside there. If anyone has extra questions, you can also contact me on Instagram at Dr. Leo Venus. And also I have a YouTube channel. And my email is also contact@drvenus.com. So anyways, hope you guys enjoyed. Thank you so much for your time. And yeah.
Thank you, Leo.